Sanitize and wash your hands regularly to keep those germs at bay. Get more tips for healthy living by tuning in to Kaieteur Radio every Monday at 1:05 p.m. for your health matters.
Good afternoon and welcome again to another segment of Your Health Matters here on Kaieteur Radio. I'm your host, Rihanna Ramsey. Thanks for joining us. Today we will be talking with Dr. Kashana James, a medical officer at the National Malaria Focal Point Unit of the Ministry of Health. And she's joining us virtually to talk about malaria and its preventative methods. Dr. James, are you there?
Hi, good afternoon.
Hello. Hi, good afternoon again. So this is your first time on the program, and we usually give our guests a chance to tell people a little bit about themselves before we start. So we'll just give you just a short bit to tell them what you do and stuff like that.
All right, thank you. Good afternoon, everyone. Good afternoon to all our listeners. My name is Dr. Kashana James, working with the Ministry of Health, currently stationed at Vector Control, deputizing as our National Malaria Focal Point. So about Dr. James, basically I graduated in 2015 from the University of Granma, Cuba. And since then I've been serving my country. I've been throughout the hinterland regions of Guyana, and I'm now placed at Vector Control, loving what I do and doing what I love. Thank you.
Okay, so we're talking about malaria today. So for those who hear about it and don't know what it is, could you just break it down for them in layman's terms? What is malaria?
All right, so a lot of persons have a lot of concepts about malaria. So one thing to note is that malaria is not a contagious disease. However, it can be a very serious and it can be a very fatal disease because it is usually caused by a parasite, and this parasite is normally transmitted from one person to the other person, and this transmission is happened by the bite of an infected female Anopheles mosquito. So normally what happens is whenever you have malaria or whenever a person is infected with malaria, the parasite tends to feed on your red blood cells within the system. And if this person with the infected malaria is bitten by the mosquito, and this mosquito then goes forth and bite another person, you would find that you have transmission from one person to the other person. In rare cases, do you have transmission along the bloodlines or the form of a blood transfusion, or if you have a shared contaminated needle or syringe. And in also rare cases, do we have what we call a congenital malaria, in which malaria can be transmitted from a mother to her unborn fetus through delivery. But principally and primarily, we would say it is a transmission of the bite of an infected female mosquito.
So there you go, people. We don't get just malaria just from mosquitoes. We can get it from through mother-to-child transmission, and if you have blood transfusion from somebody who's affected. Is that correct, Dr. James?
If they're infected, yes.
Good. Also, does malaria affect animals?
So we have never come across any studies stating that malaria can be transmitted via human to animals or animals to humans.
Mm. Okay, so there's no way that no mammal or any type of animal can get malaria.
No,
Okay.
at this point.
Okay. In terms of signs and symptoms, sometimes you might say you got sick and you got like a flu-like symptom. You might think it's COVID. You might think it's some other thing. But what are some of the symptoms that you get when you have malaria? What can people look out for?
Alright, so some of the signs and symptoms of malaria, normally when a person gets bitten by this infected female Anopheles mosquito, signs and symptoms are usually present between 7 to 14 days. And the most frequent of those are you have fevers. Some persons might have a persistent fever, meaning every day and continuously they have the fever. And in some cases, you might have persons have fevers every other day. Along with the fevers, you also have your flu-like symptoms such as your headaches, your chills, your shaking, muscle aches, tiredness. Some cases nausea, vomiting, diarrhea, and you also can present with a form of jaundice, which is basically the discoloration of the eyes and the extremities or the palm of the hands. So those are the most frequent signs and symptoms that you would find with a patient with malaria.
And how early can it be diagnosed? Do we have to wait until symptoms are present, or it can be diagnosed as early as possible?
It can be diagnosed as early as possible. So as soon as a person starts presenting with these signs and symptoms, what we advocate for is an early form of diagnosis and prompt treatment. However, for the persons that will be traveling back and forth to the hinterland regions, what we would also advocate is that these persons, whenever they're out of the hinterland region, that they can also have a checkup at their nearest facility or health center as well. In those cases, if they have a low parasite count within their system, it's possible that we can identify and pick that up and treat it as early as possible.
And we usually hear about people in the hinterland or those in the interior contracting malaria. What about the coastline areas? Is it possible that what are the incidents of malaria like in these areas?
So we here at Vector Control, along with our entomology department, we did extensive analysis and studies throughout the coastal region. And so far, we have not found the female Anopheles mosquito throughout the coastal regions. However, in instances where you have patients might be returning with a relapse, or if you have patients coming to the clinic with a suspected form of an imported or local case, what we do is an extensive form of something we call a case investigation to actually find out or actually get to the bottom of it, as in where the infected area came from, because you do have your incubation period for the malaria. So you try to date back and to track back using your incubation period for that patient as well as the malaria.
And when you find cases like that on the coastline, what is the usual reaction of the focal point unit or the malaria prevention team? What do you do? What are some of the things that you do?
If you do find those local or imported cases, what we advocate for is your case investigation. So your case investigation is made up of a team, basically a microscopist, an entomologist, and a field officer as well. And these persons are basically giving the details of the patient. They're assigned to the patient, and they would go forth into the community, and they basically do an extensive research or an extensive evaluation as in what is happening with the case in terms of your detailed information, if the patient ever traveled, where they traveled to, how long they spent, and when their symptoms actually started, besides prior to when they came to the clinic, because we do know sometimes persons might be homesick about 3 weeks or 2 weeks and they're not seeking any form of medical attention. So it's basically important to know when they first got sick, if they use any other form of medications, if anybody else in the house has traveled, if they have any travel history within the community or the surrounding environment.
Okay, we'll just take a short break, and when we come back, we'll talk to Dr. James, Kashana James, the National Malaria Focal Point Person at the Ministry of Health, more about malaria and its preventative methods. Thank you for staying with us here on Kaieteur Radio. You are listening to Your Health Matters, and I'm your host, Rihanna Ramsey. I have with me Dr. Kashana James from the National Malaria Focal Point Unit at the Ministry of Health, and she is speaking to us about malaria and its preventative methods. We were talking about how it's diagnosed and a number of other issues earlier. And now we're going to ask Dr. James how about our treatment methods here in Guyana, some of the treatment that is available to persons who have contracted the disease or who are affected by it. Dr. James?
Hi, thank you. So Guyana does have an effective anti-malarial treatment guideline. This was approved by WHO, PAHO, as well as the Ministry of Health. So basically your treatment guideline or your treatment for malaria in Guyana, it depends on the age of the patient, the drug allergy of the patient, your pregnancy status, and other factors such as if the patient came in, if they were able to tolerate medications or not. So these are some of the things that the treatment guideline depends on, as well as the type and the length of the treatment. It would depend upon the type of malaria that they have. This is basically to say, one, for a person that is suspected or diagnosed, a person that is actually diagnosed with Plasmodium falciparum malaria. Normally, this patient will be treated with our lumefantrine, artemether-lumefantrine, which is our Coartem, and Primaquine, which is just a 3-day treatment. Unlike a person that is actually diagnosed with vivax malaria, this patient will be treated with our Coartem, with our chloroquine, and our Primaquine. So the method or the type of treatment that is given to each patient depends on the type of malaria that they have, as well as the different age factors.
I've read about a type of malaria that cannot be treated, what do you call that, a drug resistant. What would you recommend in cases of persons who are drug resistant to malaria treatment?
So far in Guyana, normally what we do is every 3 years we have something what we call a therapeutic efficacy study. So a therapeutic efficacy study is whereby we normally evaluate our medications or antimalarials to see their effectiveness with the parasite. And this would normally indicate whether we need to change our medications or we can adjust it or we can work with it as is given. So we had this study in 2017, 2018. And so far what we found is that with the successful evaluation within Region 4 as well as Region 1, we have not found anyone that has shown resistance towards the medication or the parasite. And so we continue to use our medications. Prior to that, if we find that we have a person that is having a continuous relapse of the medication, principally, or a relapse of the malaria, principally for the Vivax, what we can do, we also have our first-line treatment and we have our second-line treatment. So if we find that you have a person that is constantly, maybe 3 times in a month with Vivax malaria, or 3 times in every single month they're coming back with one type of malaria, you can opt to go to your, which is according to our protocol that we have that we need to follow. It's not just you jump from first to second. But so far, technically, we have not found any form of resistance towards the treatment that we're using currently.
And in terms of where, because we touched on it, we spoke about the hinterland being the area where malaria people are diagnosed with malaria more, but hinterland and interior regions. But in what regions could you say the regions where those cases are more popular? I know Region 4 is not one of them, definitely.
So in our high cases, our high burden regions, we have regions 1, 7, 8, and 9. And of recently, we noticed that there is a lot of mining in terms of region 10. So parts of region 10, especially going to the Berbice River end, you find that you have a lot of cases coming out. So to engulf it all, our endemic regions or high burden regions, we have regions 1, 7, 8, and 9, and parts of region 10 as well.
In terms of what do you tell people who are planning to go to these regions and so on? How do you tell them what do you tell them to use, or what methods are there so that they can personally protect themselves from malaria?
So in terms of protection against malaria, one, it starts as a form of personal responsibility. That's one thing that we need to acknowledge. Two, we try to encourage these people. If you're not going into the mining camps and you're just going maybe on a vacation or you're going to a family or visit or anything of the sort, we would advocate that you try to highlight and to eliminate one, the breeding sites for mosquitoes, because one, you're not just targeting malaria, but you would also be targeting dengue and any other form of vector-borne disease. You also have the use of your insecticide repellents or your mosquito repellents in those persons like your miners and stuff that might be coming out of the mining camps and they're coming to the landings in the evenings. You kind of advocate for them to use their long sleeve clothing, and we say light colored long sleeve clothing because the dark one tends to attract the mosquito. For those persons also that have been diagnosed with malaria and is on treatment, we know sometimes, for example, for the Vivax, is a 14-day treatment. And maybe 5 days into the treatment, you feel so all better. And you think that, you're completely well and you're completely healed. So we advocate to those persons, please do not stop your treatment. You need to complete your treatment or you would find yourself having a relapse. And last but not least, one of the things that we advocate is that you use your insecticide treated nets. This is one of the biggest things in the hinterland because your net have so much effect on these mosquitoes. So we advocate that once you're going, you can uplift your nets and you can use it.
And those nets are available where?
So these nets in Georgetown, they're available at the Vector Control Services Malaria Clinic, which is located on the Middle Street entrance right above outpatient.
Outpatient, that's at Georgetown Hospital compound?
Yes.
So so once these miners are venturing into, or not just miners, persons are going into areas that you know that it's possible that you can get malaria and you're going for a certain period of time, you can uplift these nets at the malaria unit at the Georgetown Public Hospital. Are the items free or do you have to pay for them? What's the process?
So indeed, these items, the treated nettings are free. They're already paid and bought for by the Ministry of Health. So it's something that you do not have to pay for. And we advocate to the public that they take good care and use of the nettings. It's not just to have it, but to use it. So normally, to speak on the nettings a bit, one thing that we have a mass net distribution activity. Normally, this activity happens once every 3 years. And it is whereby the Ministry of Health, in collaboration with the National Malaria Program, we would distribute nettings to these endemic regions, 1, 7, 8, 9, and even parts of Region 10. So we have begun activities in terms of your distribution within regions 1 and 9, in which we have completed, and moving forward to regions 7, 8, and 10. So the idea behind the netting is that these treated nettings are soaked or they're based in a chemical. The chemical is not harmful to the skin and it's not harmful to humans. However, the chemical helps and the netting helps as a barrier because it causes the mosquito, or it repels the mosquito, and it even kills the mosquito. So what you find is that when persons actually use these nettings, you have the mosquito dying, you have a decrease in your malaria and a decrease in the incidences or cases of the malaria. So this is one of the reasons we say, because a lot of persons, they would uplift the nettings, yes, and then they would say that they have their normal or their regular nettings, but it's not the same in comparison if you're actually using your treated netting. So we do advocate, yes, you have the netting, but you put the netting to good use by using it, therefore decreasing malaria in your community as well as your region and your environment, your country overall.
So the net distribution is the primary thing that you do in terms of your preventative method as the ministry, as national focal point people. But are there any other things that you do, like for instance, are there any pill distribution, anything like that?
So we do not have any form of pill distribution in terms of prevention of malaria. What we also do, the mass net distribution, that's an activity that happens once every 3 years, but throughout the year of itself, you have the continuous distribution, meaning that there's still buffer stocks or stocks of these nettings at the various health centers or the various health facilities that persons might be able to have access to. That's one. Two, apart from that, we also collaborate on different levels with different program heads, different stakeholders that we can use to get messages out to persons in terms of what is malaria, how to go about managing malaria. We also have efforts that we are basically upscaling or increasing our diagnosis and testing methods throughout the country, because you find out when you go to the interior, you find that a lot of mining camps, they are far away from a health facility or a health post. They're in a remote area.
Mm-hmm.
So what we have been doing throughout the years, we have been working with our stakeholders, PAHO, Breakthrough Action Guyana, and even our IOM partners that are on board. And we go about training and teaching these miners or camp owners how to do malaria diagnosis and testing, even treatment. So you find that even if these persons are out of reach within the central, that there's still some amount of access point, and one camp might serve maybe 5 other camps around them. So you find that even right now in our preventative methods and our outreach to our community wise, we're increasing in that area. You see.
And we're in the pandemic. How has that affected your work in terms of distribution, awareness, and even those persons who need treatment for malaria? How can COVID-19? I mean, we know that when you have underlying illnesses, COVID-19 is more, you're more easily able. You're able to be more. You can get the disease more easily, and you can be at risk of it becoming fatal. How has the pandemic affected the whole unit, the work of the unit, and persons who are fighting malaria or who have malaria?
Good question. Thank you. So indeed, COVID-19 has affected our work in some way or the other. What we realized in 2019 or 2020, sorry, one thing that we advocate for is for persons to have an early diagnosis from treatment, meaning that all fever cases or all patients presenting with fevers within the hinterland regions, especially those within the high endemic regions, we advocate that once they present with fever, that they go to a health facility and they would get a test for malaria. So since COVID-19 came about, what we realized is because a lot of persons are scared to go to the health facilities, and a lot of persons they're worried if it might be malaria, if it might not be malaria, if it could be COVID at the end of the day. And because of this, what we realized is a lot of persons did not turn up to be tested, and your testing rate actually decreased for 2020, meaning that a lot of cases passed that could have been malaria that they did not have a diagnosis for. That's one. And two, it also affected us internally because we found that some of our microscopists and some of our technicians, they were also infected with COVID-19. And as we spoke earlier, that we do have volunteers within our mining camps and within our different regions. These persons were infected with COVID-19. And because of it, it brought a dimmer to the program of itself because we lost a lot of testers, especially our volunteers. However, for 2021, I must say...
What do you mean lost? They left the program?
Lost, no. They decided not to continue with the testing, not lost a life, sorry.
Okay, thank God.
So we find that 2021, it has been brighter because we were able to, one, give these persons a bit more information how to protect themselves, not just from malaria, but as well as COVID-19, how to go about doing a proper smearing, and how to go about a proper testing, not just protecting themselves, but protecting the person or the patient that is in front of them. So indeed, we're moving forward step by step.
In terms of the miners, do you have a program specifically designed to address their concerns as it relates to malaria? Or do you generalized outreach with them?
So in terms of the miners, principally, I'm going to highlight for Region 1. What we're doing with our miners in Region 1, recently we are collaborating efforts with the organization or the stakeholder IOM. And IOM is basically responsible for going into the different mining communities across Region 1. And they would be able to train these miners. They're training them in terms of diagnosis and they're training them in terms of treatment as well. And they will be giving oversight and overlook to them as well as the National Malaria Program. So we just don't train them and leave them and expect them to function. But on a monthly or maybe bi-weekly basis, we actually check in with them to see how everything is going. So these efforts, the same that is happening in Region 1, is basically duplicated efforts that we will be conducting or that we do within Region 7, 8, and 9 as well. So these are one thing. Our miners do have a connection with the regional folks, the regional malaria folks, which in turn would have a connection or a collaboration with the national or the central program.
So in cases where a miner or miners contract the malaria in the interior, do they definitely have to come out to the coastline for treatment and diagnosis?
Sorry, if a person or a miner within the mining camp contracts malaria, providing that their camp is not trained in doing the diagnosis and testing, if they have any other camp around them that is serving in that capacity, they can seek treatment there. That is a good thing. Apart from not being able to seek treatment at a camp close by, that person still has access to a facility within the region. Because we do build capacity within the region, maybe your health centers, your health posts, even at your landings. You build that capacity that persons can actually test and treat for malaria. So it's not necessarily that they have to come out to the central Georgetown to be tested just for malaria, but they do have access and there is scope within the region for doing testing and treatment.
How many sites are there? Could you speak to the amount of sites that you have set up that can deal with persons who are affected by malaria in the hinterland and the interior regions?
To give you a count on how many sites are there would be impossible. There are a lot of sites. For example, if we say Region 1, we have in the Matatay sub-district. There you have over maybe 50 backgrounds or so. Within there, you try to locate at least one person. So let me say we went into Big Creek today, which is another mining camp. You identify somebody suitable enough that is willing enough to actually learn the trade of malaria testing and treatment. You go through the process with them, and that is a continuous something after which the person would be certified as well. So depending on the locality that you go to, depending on how many persons serve within a locality, you would find your testers.
And these would basically be local people who are living in the area that you go in and you train, not people that you actually send in. Okay. So we'll take another break, and when we come back, we're drawing closer to wrap up because I know that you have another engagement at 1:45. So we're trying to wrap up here. We're talking about malaria, folks, and those who are interested, if you want, you can go back on our Facebook page and view the live so that you can get some information. Okay.
Kaieteur Radio, keeping you informed.
Demerara and Essequibo 99.1 FM.
Berbice 99.5 FM. Kaieteur Radio.
Welcome back to the program here on Kaieteur Radio. You're listening to Your Health Matters, and I'm your host, Rihanna Ramsey. I have with me Dr. Kashana James. She's joining us virtually to speak about malaria and its preventative methods. We covered a wide scope of information, and we are going along. Dr. James? Hello? Okay. So I wanted to know, and I'm sure other persons would be interested, in terms of our progress, remember when you go online and people are looking for places to visit, we would have an index, and Guyana is one of the places that they show you, oh, Guyana is an area that a lot of people are affected by malaria. In terms of our progress, in terms of treating and reducing the spread of malaria, what strides have we made in the past couple of years?
All right. So indeed, Guyana has made a lot of strides, and indeed, we're aiming not just towards reducing the cases of malaria, but also towards elimination of malaria, principally falciparum malaria. And throughout the years, what we have accomplished so far, we were able to basically design and implement systems that can actually give us weekly analysis of not just data at a national level, but also at the regional level. And this information is accumulated over a period of time, and it would actually highlight or demonstrate to us if you have increases of malaria within any form of region or locality. It also helps to identify if you have any peak outbreak within any prone localities or areas. So these are some of the things we're doing. We also tend to build capacity, not capacity just in our testing and treatment, but capacity at our malaria information system. So department or unit. So why we build capacity is because at this department is where you have all your basic information for malaria for the country. Building capacity helps us basically to identify at a readily and easily access exactly what is going on or what is happening within the malaria department or malaria in the country as a whole. And this information is always readily accessed. Other strides in terms of our progress, what we've been doing, basically scaling up our efforts, not just at a national level, but also at a regional level in terms of your diagnosis and your treatment. And lastly, but not forgotten, that we have been working along with various stakeholders, such as persons such as PAHO, Breakthrough Action Guyana, and IOM. And all these here help us advocate to the public and to increase our materials, our educational-wise materials, that you can actually break down your information on malaria to the smallest of the smallest population, and also to help us to basically build a community-based approach. So those are some of the things that we've been doing. Those are some of the things that we've built towards in the last years, to say. And also for those areas that are not easily accessible or that you have difficulties or challenges hearing from, we've been able to put a system in place in terms of a phone surveillance that you can have access to on a readily basis. You can call and have these different updates on malaria and their stats and what is happening within the localities. So those are some of the things that we have gained towards or working towards.
Okay. When somebody has malaria, we usually hear about treatments, but is it curable?
Indeed, malaria is curable. So what we advocate, like we mentioned before, malaria is preventable and it is curable. A lot of persons in their interim, they find that they're infected with malaria and they started treatment, and from some reason or the other, you find that they would discontinue the treatment, might be feeling a bit better, or might have a partner in the mining camp that think he got the symptoms as well, so you want to share your medications or not. So because of that reason, you find that you have relapses. However, once your treatment is used as prescribed, how prescribed, then you can be cured of malaria.
And what is it a 3-year treatment? How does that treatment work? Is it how is it diagnosed? How is it treated? Sorry, in terms of do you have to use a certain amount of medication? When how long is that duration?
So the medication basically depends on the type of malaria that you have. The duration of the medication as well would depend on the type of malaria that you have. For example, going back to if we had falciparum malaria. So if you have falciparum malaria, basically your treatment would be your Coartem with your Primaquine. And your Coartem is basically a 3-day treatment and your Primaquine is a 1 day. So total, your treatment lasts for 3 days. Normally after the 3 days, 7 days after, we would ask that a person return back to the clinic to have a recheck. With a recheck, most likely what our outcome would be, and negative results, meaning that the parasites are cleared out of the system. The malaria parasites are cleared. Unlike the Vivax treatment, which is a bit more lengthy than the Coartem, so normally we would use the chloroquine and the permaquine. The chloroquine basically is a 3-day, and the permaquine lasts for 14 days. Normally, if you have interruptions in your treatment, because a lot of persons after finishing the chloroquine, they find it difficulty to continue on the permaquine for 14 whole long days. Because one, they think that they're going to interrupt their treatment, they think that it's going to interrupt their job or whatever the case may be. However, if you do stop your treatment, if you do discontinue your treatment, if you do not use the treatment as you're supposed to, what you find is that you do have relapses. If you're good enough to continue your treatment and to complete it as recommended and prescribed by your physician, and you do your recheck, you find that you do also have clearance within your system as well.
So you mentioned the type of malaria. Can you break that down? Are you saying that malaria has different types, like different variants of COVID-19?
Yes. So malaria does have different types. We have our principally 4 types of malaria in Guyana. We have our Plasmodium falciparum, we have our Plasmodium vivax, we have our Plasmodium ovale, and in rare cases we have our Plasmodium malariae. So those are the types of malaria in Guyana. And if we do have treatment for them, yes, we do.
Okay, and there's the difference would mean the higher variant to the lower variant. That is what you're saying there, basically.
Sorry, I didn't get you.
I'm saying the names that you call it the differentiation would mean one is higher and one is lower.
All our malaria all have the same symptoms. The only way you can know the difference between it is by doing the testing, and that test would actually identify what species you have of the malaria. However, in the case of the falciparum malaria, we find it to be a more aggressive malaria and can complicate faster than the other malaria. Yes.
So our general focus today would have been not just the malaria, but we were talking about prevention. And I know that you work at the National Malaria Focal Point at the Ministry of Health, and you do a lot of work in terms of net distribution, mosquito net distribution, and so on to like help persons protect themselves against the spread. Generally, what are some of the other things that you do? Because we're trying to wrap up in the next couple of minutes, because I know you have another engagement, your job, your duty calls. So just before we go, how can persons get more information, and what are some of the other things that you do so that you can reach out to the public so that they can be aware of what they can do to protect themselves?
All right. So in terms of your protection and prevention against malaria, like we stated before, it's all about a self-responsibility. If you know that you're traveling, you can use your preventive measures such as your insect repellents and such as your mosquito repellents. If you find that you go to the locality and they have a lot of mosquito, we also advocate that you use your long sleeve clothing, your light long sleeve clothing to be exact. You also have the use of your treated nettings as well. If you think that you have signs and symptoms of malaria, you should get tested as early as possible, and if you're diagnosed with malaria, then use your treatment and use it correctly as prescribed by your physician. Those are some of the things that we would advertise to the public in terms of your malaria wise. What we're doing from the national program in terms of the prevention or protection against malaria, or rather focusing on the elimination of malaria, is that we know that this is not a unilateral but a more dynamic and coordinated and a collaborated effort with different stakeholders. Malaria prevention is essential, and from the national program we have 5 pillars that we focus on. In terms of our program management aspect, whereby we help to strengthen not just the national but the regional capacities, and you try to facilitate coordination throughout the regions with the central program. We also have our diagnosis and treatment aspect, in which we improve the quality of all our facility-based services, not just at the private but at public health sector levels, and also at the community level wise as well. Surveillance, when we talk about our surveillance aspect, is basically strengthening our data management aspect of the malaria, that you can actually know, have positive information or negative information, and you can know how to handle the information and what are the necessary steps or intervention needed based on the information that you're acquiring. You also have your vector control aspect, in which we will talk about our nettings as well, and this would include reducing your host to vector contact by increasing the use of the personal protection. This would include your treated nettings as well. And last but not least, we have our IEC materials, or your SBCC. Basically, this is where we advocate in a way that you can reach to your community wide, and you can help them to know their risk reduction behaviors that they can practice in order to prevent and to protect themselves from malaria.
Okay.
What they do, sorry,
Go ahead.
I was saying, if persons need more information, we have our Ministry of Health webpage, our Facebook page as well. You also have information in terms of malaria and our treated nettings, even the campaign that we're having. You have a Breakthrough Action Guyana Facebook page as well, that you can have information there. Or we have our main office in Georgetown, that is above Outpatient Middle Street entrance, Georgetown Public Hospital, the building. And you have your regional departments and your regional malaria offices, as well as your health posts, that you have your health workers there. So all these persons can facilitate in some amount of information.
A lot of people are on social media, so could you repeat the Facebook page?
You have our Ministry of Health Facebook page, but you also have our Vector Control Services Facebook page as well. And you also have our Breakthrough Action Guyana Facebook page as well.
So there you have it, folks. So it's time for us to wrap up. We're doing a bit of early wrapping up today because doctors are quite busy people, and Dr. James has another engagement. So thank you for listening. Thank you for joining us wherever you're joining us from, on Facebook or on the radio. We hope you've gathered some information on malaria, and we hope that you stay safe. You continue to practice the COVID-19 guidelines and stay healthy until you next week, when you can join us again. Be good to yourselves. Bye-bye.